with our webinar here. So welcome everyone to the fourth session of our 2022 fall webinar series. Just a few housekeeping notes before we get into the presentations. If you have questions during the presentation, you may type them in the question box or the chat box on the bottom right hand side of the control panel, and we'll be sure to answer them following each presentation. Our webinar today is scheduled to take approximately 1 hour. If we run out of time to answer all of the questions that come in, we will follow up after the webinar or ask our presenters to reply to these in the chat. A link to the recorded webinar will be sent out to all registered participants and will be posted to our website, saskatchewan.ca/agriculture, probably about 24 hours following the live presentation. At the end of this session, you will be prompted to complete a short survey. Your feedback is important for planning future events, so please consider filling that out. I will now turn the webinar over to your facilitator for this session.
Good afternoon, and welcome to the fourth broadcast of the 2022 Fall Webinar Series. And we'll be discussing avoiding winter feeding issues and alternative feeds. I'm Dwayne Summock, Livestock and Feed Extension Specialist with the Saskatchewan Ministry of Agriculture based out of Kindersley. I will be facilitating today's webinar on avoiding winter feeding issues and using alternative feed resources. Our first presenter today is Dr. John Campbell. Dr. Campbell graduated from the Ontario Veterinary College, University of Guelph in 1985. After several years of rural veterinary practice, he returned to Guelph to complete a Doctor of Veterinary Science degree in ruminant health management. He has worked as a clinical faculty member on the ruminant field service practice at the Western College of Veterinary Medicine at the University of Saskatchewan since 1991. He served as department head of large animal clinical sciences from 2011 to 2017. His primary research interests are in beef cattle production medicine, and disease surveillance in beef cattle. He currently acts as the director for the college's disease investigation unit and is an associate editor for the Veterinary Evidence Journal. Dr. Campbell has over 90 scientific publications in scientific journals, along with numerous conference proceedings. He has been the recipient of 5 teaching awards at the Western College of Veterinary Medicine and was the recipient of the 2007 Carl Block Award for contributions to Canada's animal health programs, the 2008 Western Canadian Association of Bovine Practitioners Veterinarian of the Year Award, and the 2019 Canadian Beef Industry Award for Outstanding Research and Innovation. At this time, I would like to turn the webinar over to our presenter, Dr. John Campbell.
Thanks, Dwayne. Can you hear me and see my slides okay? Is that all working?
It is all working, John.
Okay, great. Thank you so much. Thanks for having me. I'm just going to run through some winter feeding cases we had this last year on our WCVM disease investigation unit and talk about a few of those. And certainly when I do that, I got to acknowledge the funding we get from the government of Saskatchewan, plus the help I sometimes get from some of the livestock specialists on some of these cases, as well as all of my colleagues in Prairie Diagnostic Services who, without them, I wouldn't solve very many of these cases. So the people in toxicology and pathology and all those other ologies there, they're a huge component of trying to figure out some of these issues sometimes. So I'm just going to go through 3 or 4 cases here quickly and talk about some of these ones that we saw that were this past year that had sort of winter feeding implications. The first one's kind of an unusual one that I've never seen before. It was a bunch of cows dying suddenly in a cow-calf herd where the producer got a new delivery of some flax screenings. They were green flax screenings. They were from a local seed grower, one of his neighbors actually. And when he got this delivery, he fed about 6 pails of these screenings to about 40 cows, about 3 pounds each is what the cows got. And then within 5 minutes, it was pretty obvious something was wrong. A lot of these cows began to show clinical signs. They went down, they were weak in their back legs, twitching their eyelids. Here's a quick picture of the screenings that he was feeding. And within 10 minutes, there's 8 cows dead. There's not a lot of things that can kill cows that quickly. And the local veterinarian went out and took a look at some of these cows and took some samples. Here's a close-up of one of those cows shortly after it died. And they sent samples into the diagnostic lab, and there were really not a lot of findings on the tissues that they sent in. There was pretty severe congestion of the kidneys, brains, and lungs that were sort of indicative of acute circulatory failure. And there was a bit of pulmonary emphysema, which is likely just agonal as those animals were dying. But what was interesting was the cows were extremely copper deficient. Normal liver copper is somewhere around 25 to 150 parts per million. And these guys, a couple of these cows where liver samples were submitted, they were like 1.56 parts per million rather than 25, 2.1 parts per million. So extremely, extremely deficient. So what we think the diagnosis on this case is cyanide toxicity. There's a number of plants that can accumulate large quantities of cyanogenic compounds, sometimes called prussic acid or hydrocyanic acid, and flax is one of those. And when plant cells rupture, this cyanogenic glucoside can be released and converted into hydrocyanic acid. And it can obviously be exacerbated in stress plants. So obviously we had significant drought last year, and frost can also do this. This cyanide is absorbed into the bloodstream. It actually just prevents oxygen from being released from hemoglobin. So the oxygen gets bound to the hemoglobin, but it can't be released to the tissues. And so basically these animals die very suddenly due to asphyxiation, basically, because they're not getting oxygen into their tissues. So clinical signs are exactly what we saw here: staggering, labored breathing, convulsions, collapse, sudden death. And really the only pathological sign is blood that's bright red in color, this sort of cherry red blood. And if you look closely on some of these animals, you can see how bright red the sclera is around the eye there. The sclera are quite injected and bright red, and I think that would be indicative of cyanide toxicity as well. I think though, as I thought about this case, and I kind of wondered, well, why didn't all die? And maybe some of these cows that the producer said that the cows that died tended to be the most aggressive ones that ate first and ate the most, etc. But these cows were also very, very deficient in copper levels, and copper's necessary for the metabolism of iron. And one of the major symptoms of severe copper deficiency includes anemia. So I'm kind of wondering, and that perhaps this combination of severe copper deficiency plus a cyanogenic feed might have been more lethal than usual. If we had fed those flax screenings to cows that had normal copper levels, perhaps we wouldn't have seen sort of quite the same effect as we saw in this case. But an interesting case. I've never seen what I think is cyanide toxicity for sure before. There's no conclusive diagnostic test, but it is, I think, pretty clear cut that there's not too many other things that could kill cows quite that quickly. Second case, this was again in the winter of 2022. I think I've got a herd of 500 cows. It's actually 50 cows. It's a small herd, well-managed herd on a pretty good vaccine program. And they're currently, actually, this is the 500 cow herd. It's the next herd that's 50 cows, sorry. The pretty well-managed herd, currently being fed this ration that's predominantly straw, somewhere in the neighborhood of 40 pounds of a combination of flax and canary straw, and then 9 pounds of barley grain on top of that. The local vet comes out to examine this one cow that's down, and she's got enlarged abdomen. She's off feed. The vet treated her with mineral oil and meloxicam, and she's found dead the next day with a prolapsed uterus. So they sent her in the diagnostic lab, and obviously the probable cause of death was due to the uterine prolapse, which isn't maybe terribly surprising. But when they look at her rumen and abomasum, it's filled with fibrous ingesta and quite extended. There's some foci of mineralization on kidney, and so diagnosis is pretty straightforward here. It's ruminal impaction. So even though this cow died from the uterine prolapse, there were probable pretty clear signs of ruminal impaction. If you plug sort of their ration into cow bites, there's no way they're eating that much straw. Obviously that, they probably can only handle maybe 15 pounds of straw at most. And even that's going to be probably way too much NDF. And this ration would probably still be somewhat deficient in energy and protein when you looked at it. But probably most importantly, far too high in NDF levels. And 1.5% NDF is percent body weight. I think Jennifer must have seen my presentation before she set up her questions today, because many of them sort of fit right in. But flax straw, especially high fiber straw, fed at a maximum of 10 pounds per head per day, probably is a rule of thumb. And they're far exceeding this. So a good recipe for ruminal impaction, which I'm sure many of you have seen other examples of in this past winter when there was a lot of straw-based rations going on. My third case is the 50 head herd. So sorry about mixing that up. They're being fed again, pretty unusual ration. Well, not unusual for last year, but certainly mixed grass hay plus slough hay and some green feed. The slough hay had cattails in it as well. They got a pretty good vaccine program. The local veterinarian says they're pretty well managed herd for the most part, but they've had a total of almost 16 animals die over a period of 3 weeks. They start sort of in early January through the month of January, and then they have a big cluster in February. Cluster of about 6 animals died on February 5th to 6th. And they'll all reported as sudden deaths, that they're fine one day and then they're dead the next. This is tending to happen in really cold weather. Some of them have blood coming from the vulva, rectum, and nose. So there's a little concern about anthrax here from the local veterinarian. So he gets called out to look at a couple of these deaths, and he necropsies 2 of these cows. He looks for blackleg, another cause of sudden death, can't find that. He does a mineral panel on a liver, looking for copper toxicity, no evidence of that. Mineral panel looks relatively normal on that cow. He does a met hemoglobin test on the blood of one of these dead cows, and it's positive, which is suggestive of nitrate toxicity. One animal, he doesn't see any clotting blood, so he's worried about anthrax. He sends in some tests for anthrax. There's chocolate brown colored blood in another, which might be nitrates. He's worried about that. They do sort of notice some low fat reserves. And I think he sent in some samples to the diagnostic lab as well. So trying to figure out what's going on here. So, discuss this with Dr. Blakely in the toxicology lab. Could this be nitrate toxicity? And Dr. Blakely says, well, maybe we should discard those bales that you're being fed and feed something else. They looked at some feed test results with the local livestock specialists and sort of agreed that the feed tests and the bales look normal and kind of average for that year. I think I've got one example here of one of those hay samples, the grass hay sample here, crude protein on a dry matter basis of 10.4%, NDF at 64.7%. So you can sort of have a quick gander at that. I think I didn't put all the other samples in just for brevity's sake here. They did send one animal to PDS in February that died, and it was tested for anthrax again before they did the necropsy because they're concerned of these sudden deaths, etc. Perhaps doing that. They noticed some evidence of necrosis in the liver, this sort of pattern associated with acute hypoxia, which would kind of fit with nitrate toxicity. There's a bit of mild pericarditis. There's nothing really obvious. The pathologist does comment on suboptimal body condition. So I got that in quotes there. Not sure how severe that was, but they do comment on that. They send in some liver nutrition, but it's pretty normal. There's some marginal copper, which is just a little bit below normal, but but everything else is fairly close to normal. They did test methemoglobin, and the concentrations were elevated, but the nitrite levels were normal in the tissues, and the nitrates in the feed were normal. So Dr. Blakely starts wondering about some kind of oxidizing agent, like a chlorate herbicide that can cause methemoglobin, which was a new one to me, but there was no sort of possibility of that of these cows sort of being exposed to that. So that seemed a little bit unlikely. I got involved a little bit later, and they had some more cows die sort of the end of February, early March. And so I convinced them to send a whole animal into PDS. They had recently switched feed to some 2-year-old feed because of, you know, the concerns that maybe it was a feed issue involved in these feeds. Again, because it was an anthrax suspect, they had to do testing carried out prior to necropsy. The results were negative on that. So this animal got to the diagnostic lab, and I got some pics of it on the post-mortem table here, and I think you can see pretty clearly from this picture that the body condition is definitely suboptimal. This cow was pretty skinny. I think I've got another picture here. You can see her spine, you can see her hips, and you could count her ribs. She's probably a 1 at best, and quite thin. And then at necropsy, again, the clinical signs were pretty obvious. Here's the heart, and what's really obvious in both this picture and the next picture is, you know, there's no evidence of fat at all. Usually there's white fat around the top of the heart, and all you see is this sort of shiny, glistening material there. Same in the abdomen. There's really no fat around here. This is the liver here. This would be the back along this side here. Here's the liver and rumen and other organs over here. So just absolutely no body fat. When they split her femur open, you can see this serous atrophy of fat, this red jelly-like material in the bone marrow, which is basically evidence of emaciation and starvation. And here, even when we wash out that bone marrow, you can see that the trabecular bone in the femur is actually starting to disappear. There's actually osteopenia or bone loss because this cow's had an inadequate ration. So this cow for sure was emaciation and inadequate energy ration, probably in extremely cold weather. She had deficient hepatic copper. She's an obvious starvation case or lack of energy. Were all the deaths exactly the same? I'm not sure. It was a bit of a confusing case, and it just shows you how you can get off on the wrong track if you start looking for anthrax and some of these other things. There was maybe some possibility of some kind of other condition going on in some of these other cows, but definitely this one for sure. She was not getting enough groceries and was a straightforward inadequate energy one. To finish off, I want to talk about a couple of unknowns that we've had and how they're still going on. This is a picture from a case a couple of years ago where we've had all these low birth weight calves, and again, we continue to see those occasionally. Don't quite know what's going on with some of those. All of them have been very low in manganese, and their dams are very low in manganese. Whether that's the reason why they're having low birth weights, we're not sure. But we continue to see those from time to time and don't really have a good explanation on some of those as well. It's obviously an in utero issue going on. And speaking of in utero issues, the new one that we've seen this year is this liver necrosis in calves. We've identified some cases at Prairie Diagnostic Services, and then at the University of Calgary Vet College, they've also had some on their pathology service. These calves start to show clinical signs usually in the first week of life. They're often weak or kind of poor doing. Sometimes they show some signs of neurologic disease, and many of them die. That pretty high rate of mortality. There's no issues in the cows, and in fact, in many of these herds, the cows have been in reasonably good body condition, certainly no problems in the cows, no abortions, and some herds have had pretty substantial losses. But when you see these cases, here's the liver here, you can see that bright yellow coloring there. It's pretty obvious there's pretty severe liver damage there. It's pretty easy to see these lesions, and they're quite dramatic. And probably we think that these are happening in utero, and these calves are born with this condition to some extent, but we don't have a good explanation of why. We haven't had sort of any identified commonality between herds in terms of feeds and feeding. One herd in Alberta was being fed corn-based rations that was imported from the US, and we wondered about aflatoxins, but again, the cows are normal. So why would the aflatoxin just affect the calf and not the cow? It was silage-based rations in several other herds. I'm pretty convinced the lesion is developing in utero. It's not happening after the calf is born. We've done a little bit of work to look for some weird viruses or bacteria, but we haven't demonstrated any specific infectious agents. So something to watch for, and certainly we'd be interested in looking at more of those cases if any of you are exposed to herds that are having unusual calf deaths. And certainly the lesions are pretty obvious that we can, if a postmortem gets done, we can certainly see the lesions quite obviously. The last case is another herd that I went to up in the Tisdale region, where we didn't get a great diagnosis. These calves were again born quite with some unusual neurological signs, usually at a few weeks of age. Cows were in great body condition, as you can see from this video. No problems in the cows. The cows were actually fat, which was unusual to see. Bunch of calves looking like this, though, some of them blind. I actually wondered about vitamin A deficiency. Again, we've seen that caused by vitamin A deficiency in utero, probably in early gestation. Now, these cows actually got supplemented with vitamin A injections, and the calves got vitamin A, so they certainly weren't deficient when they were born. But I guess we have questions about what was going on 8 months ago in early gestation, whether they were perhaps vitamin A deficient there. But again, not a great explanation of that kind of lesion in those calves. So there's the same video again. So just a quick run through on a few of those cases that we saw this year. I'm happy to try to answer any questions or respond to any comments that you might have about those cases. So thanks for having me again.
Thank you for your presentation, John. At this time, we're ready for questions. Please refer to the question section of the drop-down box on the right-hand side of your screen. Currently, there are no questions in there, but
there is one question in there, Dwayne. The question is, are liver biopsies the best way to assess copper levels in a herd?
Yep, that probably is a true answer, that yes, liver biopsies are the best. They probably give you the best representation of what copper truly is. However, I think blood is still useful, and I wouldn't say you have to do liver copper. It's probably superior to blood, but we've learned a lot by doing blood samples over the years as well. And if they're deficient on blood, they're truly deficient. So it's probably still a useful tool as well, and a little bit easier to get producers to buy into doing that than the liver biopsies sometimes. Liver biopsies aren't hard. They're easy. It's hard to get enough liver tissue sometimes, unless you're using the right kind of trocar. So, but they're certainly not difficult to do. And I've done hundreds this last few years and haven't killed anything yet. So.
And can that be done just with a local veterinarian, or where would the best place to go to have those biopsies or those bloods taken?
Yeah, well, the bloods are easy. Right? Any veterinarian would be happy to do that. And liver biopsies are not a difficult procedure. There probably are some veterinarians less comfortable with doing them than others, just because it's not something everybody commonly does. But it's certainly not a difficult procedure, and I know many veterinarians that do them quite routinely. But there's probably some out there that would be less inclined to be jumping in on those.
And we are awaiting any additional questions.
There's another one in there, Dwayne. I'm not sure. Maybe
How are
can't
you
see
seeing them that I can't see them?
I don't know, but that's okay. I can ask them. Are chelated minerals worth the extra cost when dealing with some of those trace mineral type issues?
That's a good question. Probably better answered by Dwayne and Jennifer than myself. But yeah, probably in some situations. Certainly, we see a better response to chelated minerals when we have high sulfates and things like that in some places. But maybe Dwayne and Jennifer want to answer that one more so than me. Probably depends on the situation.
And John is correct, it depends. We do know that chelated minerals are more readily absorbed in the small intestine. So the question is, are they getting to the small intestine? And so if it's a water related issue, I think Dr. Penner's work recently has indicated that it's actually not a huge advantage. But if it's a situation where the minerals are getting through the rumen and there is issues, if it's rumen fermentation related, there is an advantage. So it depends is the right answer.
I don't see anything else there in that question box right now, Dwayne. John, are you available till the end of the webinar?
Yeah, you bet. Thanks for having me.
Okay,
Thank
thanks.
you very much for your presentation, John. At this time, we'll move to our second presentation, which will be made by Adriane Good, who is a livestock and feed extension specialist with the Ministry of Agriculture. She has recently started with us after spending 5 years working for the Montana State University as an agricultural and 4-H extension agent in north central Montana. She's originally from southern Alberta, and Adriane has always been passionate about livestock production and has her master's in animal science from the University of Saskatchewan. As a livestock and feed extension specialist, she enjoys assisting producers with feeding decisions, water quality issues, and livestock management. At this time, I will turn the webinar over to Adriane.
Thank you, Dwayne. Is everything showing up well, and can you hear me?
We are seeing your presentation and hearing you well.
Perfect. Thank you for the introduction. I'm excited to be back in Saskatchewan and to have my first presentation with the ministry here. I don't know why I didn't realize it before, but John Campbell is actually my external examiner for my master's, so it's kind of neat that my first presentation back is in conjunction with John's. So after he spent so much time scaring us about how alternative feeds can really cause some wrecks, we'll go through some things to do to safely use alternative feeds, if my PowerPoint will work. But first, I like to start things off with a chat bomb. So if you haven't done these before, you will type your answer in the chat box, not the question box. Do not hit enter yet, and then at the count of 3, everyone will hit enter at the same time. So the answers will all come shooting out at once. So the question is, what alternative feed sources did you use in 2021, or are you looking at using in 2022? So go ahead and type your message in the chat box. Don't hit enter yet. I'll give you a couple seconds and hopefully it works. Awkward silence for a bit. So what alternative feed sources did you use? And we'll hit enter in 3, 2, 1. Okay, we've got oat hulls, pea flours, screenings, kochia. Maybe I didn't leave enough time. Okay, we'll go on, but those are all great sources, can be used very well. Oh, canola hay, another one, perfect. So we're going to go through some things you can use, or some things to keep in mind while you're feeding alternative feeds. So there's a few reasons to be wary of new feed sources. One is feed quality. It was mentioned earlier by John. Fiber, it was mentioned in our polls there at the beginning with fat, including mineral levels. Are you deficient or do you have too many minerals? Nitrates are a big problem in Montana. I dealt with a lot of nitrate problems. Non-protein nitrogen is also something we can see causing problems. Oxalates, prussic acid, again briefly mentioned by John. And then poisonous plants, it's more of a summer problem than a winter problem, but I think it's a good idea to just keep in mind. Maybe don't feed your cattle Western water hemlock because it will kill them. But if you have issues with poisonous plants, definitely one of us livestock and feed extension specialists can help you with those. So we're going to go through all of those in a little bit more detail here. Starting with feed quality, number one question, will it provide the nutrients you need? So first, just take a look at your stack yard. What do you have already? If you have some really good hay, but you just don't have enough of it, you're probably going to be needing both protein and energy. So what can we find to help thin that hay out? If you've got maybe a lot of straw and then a decent protein source somewhere, you're going to need some energy to keep those cattle full or keep those cattle going. Also look at, I don't have it on the slide, but fat. Too much fat will slow the rumen down, so make sure you're looking at fat with things like canola if the seeds are present. NDF and ADF are fibers. NDF drives intake and ADF drives digestibility. If we get too much fiber, we're going to see issues with impaction and just them not eating it. And then the mineral levels, is there enough? Is there too much? So some common culprits that we think about with feed quality, and feed quality matters with everything. It's not just these three things I have listed on the slide, but screenings are a big one. I know a lot of people who are selling screenings like to say that they guarantee at 65% TDN, but is that always true? I've seen screenings range just this year from 60% TDN to 82% TDN. So we've got energy levels all over the place with our screenings. So it's good to get them checked out, see what we're dealing with. Cattail hay, just because it's called hay, doesn't mean it's a great feed source. Cattail hay is closer to straw than any other hay. So we're going to be looking real hard at our fiber levels. And then canola meal, we talked about canola hay, but canola meal sometimes, or some of the processing systems for canola oil use sulfur. So canola meal can be notorious for collecting sulfur. So it's a good idea to keep an eye on that. DDGs are also similar. So how do you reduce the risks associated with feed quality? Number one, feed test. You cannot manage what you don't measure. I don't remember who said that first, but someone said it somewhere and it stuck with me. If you measure high sulfur, if you measure really low energy, really high fiber, we can manage it. We just need to know what we're dealing with. You can also look at improving feed qualities. One of the examples I have is ammoniating oat hulls. There's a lot of research done on it, I think like 20 years ago. That does come with its own set of issues, but it can help to improve feed quality a little bit. Or processing, when we're looking at any of our grains, you definitely want to process most of those to improve the digestibility on them. And then improve the palatability, or just improve the intake of feeds that maybe they don't really want to eat just because they're gross for some reason. Molasses, everything loves molasses, or mixing it into a TMR can kind of help with the intake. I'm not going to say TMRs will solve all of your intake problems, but kind of mixing it in a little bit, hiding it maybe, might help. Just kind of like if you're feeding kids a smoothie with vegetable and it's to trick them into eating their vegetables. So here is an example of a feed test that was done through our office last year. This is a kochia silage feed test. So we have our protein tested at 14%, so it's a pretty decent protein source. We're looking at all our minerals. They look okay, with the exception of sulfur is super high, or not super high, but higher than we would like to see. Cattle's maximum tolerable level of sulfur is 0.5%. So we know that we're going to want to mix this kochia sample off with something else so that they're not eating too much sulfur. I'm going to look at ADF and NDF. They look okay, and TDN almost 65%. Probably going to be decent for our energy, so our big concern here is going to be the sulfur. But it's always good to take a look at this, figure out what you can mix, how you can improve the sample, bring that sulfur down without losing all your protein and energy. So the next one we're going to go into is nitrates. It's going to go a little bit into what nitrates do in the body. I know John had mentioned that there were some issues with methemoglobin, so we'll talk about how that happens. So first of all, in a normal situation, cattle can consume some level of nitrates. In the rumen, that's reduced to nitrite, which is then reduced to ammonia, which can then be used as protein for the animal by the rumen microbial community. So a little bit of nitrates goes through the ruminant just fine. What happens when we get too much nitrate? All of a sudden, a lot more nitrite is produced. The rumen just can't keep up, kicks some of that nitrite into the blood cell, or into the bloodstream. The red blood cells pick up the nitrite. The hemoglobin picks up nitrite instead of oxygen, forming methemoglobin. All of a sudden, your blood isn't carrying oxygen. We already got that. You're going to have a bad time. You're going to lose some cattle or see some poisoning symptoms. So some signs of nitrate poisoning, the first ones are going to be things like watery eyes and reduced appetite, reduced milk production, probably start to see some abortions, shortness of breath, weakness, staggering, cyanosis, which are just discoloring of the blood. If you look at their eyelids, they're going to be not bright red, they're going to be kind of brownish or bluish. So our common culprits for nitrates are going to be drought or frost stressed plants. Pretty much anything that stresses a plant out will cause it to accumulate nitrates. And down south, we don't get a lot of rain. It's pretty dry. A lot of plants are drought stressed. The other common culprit is cereals, especially when they're fertilized for grain production. I think the highest nitrate samples I have seen have been cereals fertilized for grain that the producer ended up deciding, nope, they're not going to make grain, just going to green feed it. However, they already had all that nitrogen available to the plant, and the plant took it up, got stressed, accumulated nitrates, and then we see high nitrates. So to reduce nitrate risk, you can ensile your forage if you already know before you even cut it that you're going to have high nitrates. Ensiling it can reduce the nitrate content of the feed. Feed test, a lot of places test for nitrates. Feed it in limited quantities. If you do have really high nitrate feed, we can usually mix it off to bring it down to a tolerable level for the whole ration. You can also increase the energy in the diet. Now you can't do this pretty much unlimited, but if you have riskier nitrate levels, if you up the energy just a little bit, it'll help those rumen microbes keep up and continue converting that nitrate to protein. You can also give time to adapt, let those rumen microbes adapt. The rumen is a complex environment. It takes a long time for those microbes to change. So if you just give it time to adapt, slowly integrate more higher nitrates, then you'll do okay. And then finally, feed it to non-pregnant animals if it's, again, on the risky side, not in the killing cows side. But if we're looking at, say, like above 0.5% and you're a little worried about causing abortions, just feed it to the steers. They're not going to abort. You're going to be okay. You'll probably lose some performance, but you won't have dead calves. So here's that kochia silage feed test again. Had nitrates tested on it. So the nitrate on this one is 0.24%. So we're probably going to be okay with that one. Here is the nitrate safe levels. This is from our SaskAg website. So generally safe at 0.5% for nitrates. We have started going to ANL labs in Ontario too, and they report their nitrate as nitrate nitrogen. So it's just a good idea to keep an eye on how your nitrate is reported in your feed test, because those limits are going to be different. So if we're reporting as just nitrate, then our safe limit is going to be 0.5. If we're reporting as nitrate nitrogen, our safe limit is going to be 0.12-ish. Once we get above that, we can exercise caution, see some feeding management. Anything, you don't really want your ration to be above 1% for just plain nitrate. Okay, so non-protein nitrogen. There's a lot of people who have used liquid protein supplements that are full of urea, and there's been some other non-protein nitrogen sources out there, so we can have some issues with that. So normally ruminants can use non-protein nitrogen as a protein source just fine, with the same process with nitrates of turning it into ammonia then protein. So what I didn't talk about with the nitrates was that ammonia also goes into the liver as per normal and is either excreted or recycled back into the rumen. So nitrogen recycling in ruminants is incredibly complex. I'm not going to go into any more detail than that because that could take up several hours just on its own, but the ammonia can recycle through the ruminant. So what happens if we have too much non-protein nitrogen? Again, we're overwhelming the rumen microbial community. It can't keep up. All of a sudden, we have way more ammonia going to the liver and ammonia entering the bloodstream. The liver gets overwhelmed. You might see some liver damage. The liver is going to kick even more ammonia into the bloodstream. If the blood's carrying ammonia, that's kind of a bad thing. Your blood isn't supposed to have a whole bunch of ammonia in it, so you're going to see some problems. So some signs of non-protein nitrogen poisoning. You'll have animals going off feed and water because they don't feel good. They'll be coughing, grinding their teeth, twitching muscles, and ultimately they could die. So some common culprits, ammoniated oat hulls. You're mixing ammonia in, that is a non-protein nitrogen source. You could see some risk coming out of those. And those urea-based liquid supplements are another common culprit. So how do you reduce the risk? Feed it in a limited quantity. Limit anything that's not just crude or protein to 1/3 of the dietary protein or 1% of total diet. So pouring a bunch of liquid protein supplement out, giving the cows 20 pounds a day of that is not going to be good for them. You can also increase energy in the diet again just a bit and give time to adapt, similar to nitrates, help that rumen microbial community adjust to the non-protein nitrogen and give it a chance to use it as protein. Okay, so oxalates are another one that we see sometimes. Again, ruminants can use some oxalates. In the rumen, it's not reduced to ammonia, thankfully. It's reduced to carbon dioxide and formic acid. Carbon dioxide just leaves. Formic acid can be used as energy. So what happens when we get too much oxalate? We overwhelm the system. It goes into the blood. It just can't handle it in the rumen, into the blood. And in the blood, it finds its best friend, calcium, and binds up calcium. What happens then is you get a reduced blood calcium because calcium just can't move because it's stuck to this oxalate. Generally, that's a bad thing because calcium is important for a lot of things, including muscle function. So if you don't have muscle function, you're going to have a bad time. So some signs of oxalate poisoning, we've got muscle tremors, weakness, collapse, and death. Common culprits are going to be kochia. Kochia can be a great feed when it's not trying to kill all your animals, and lamb's quarter or really any of the pig weeds. How do we reduce the risk? I would love to say feed test, but I could not find a lab in Canada that does do oxalate testing. I'm not saying that it doesn't exist, just I could not find it on any of the submission forms that I looked at. So what you can do is you can feed those risky things in limited quantities, just be real cheap with them, and increase the calcium in the diet when you are feeding those risky feeds, just to make sure your bases are covered. Thank you, John just said, have to send samples to UC Davis for oxalate testing. So definitely not a quick test, and thank you, because I looked for a long time. Okay, prussic acid, again, I'm not gonna, John did a pretty good job covering this one. It's in cyanide and it inhibits oxygen utilization. The common culprits, green flax is a big one around here, and sorghum Sudan grass is popping up. I had a couple sorghum Sudan grass questions already. Frost is the big thing that kind of triggers the prussic acid in these plants. To reduce the risk, feed test. Again, I looked long and hard and I could find one lab in Canada, that was Fraser in BC, that does the prussic acid test. And then feed in limited quantities. If you want to send it to Fraser, we sure can. Here is a table from South Dakota State on the level of prussic acid that can be fed safely. 500 ppm is generally safe. Looks like pretty much limited to 500 ppm for your total ration, which is not a lot. So those risky feeds, make sure you're feeding in low quantities. So with all these things we just talked about, is cheap feed really the best value? We can talk about price per pound of nutrient. I do have a couple slides later on that we could go through if we have time, but I don't know if we will. Or we also have the other costs associated with the feed. So you may be saving money on the feed, but are you losing money because your cows are all aborting? Are you losing money because your feeders just aren't gaining that well? Also death loss. Is your feed cheaper than a dead cow? So look at these other costs and think about what is really the best value for your operation overall, and not just the cost, the price tag on that feed, or the quoted price for all those straw bales you get. So take home messages for feeding alternative feeds safely. Feed test. If you forget everything else I said today and you just remember to feed test, that's okay. Please feed test. It's the most important thing. Incorporate your risky material slowly. If you've got something that's high nitrate, high non-protein nitrogen, incorporate it slowly. Give the room and environment time to adapt. And anything is possible within reason. We just went through a few dangerous things, but there is so many feed options out there. And as long as you're testing your feed, making sure it doesn't contain those or doesn't contain too much of dangerous compounds, then you can feed it. Work with a livestock specialist, or if you have a private nutritionist you like to work with someone, develop a ration. Your cows can do a lot of magical things with some strange feed. So we'll stop there for questions, if there are any.
Thank you very much for your presentation, Adriane. And I believe as long as I pop the question box out, I'm seeing the questions now. So please take a moment and enter your questions. And so the first question in for you, Adriane, is do you have any pointers on selecting the right feed test when sending samples to a lab?
I like to make sure it contains protein, TDN or total digestible nutrients for energy, definitely NDF because it helps with formulating rations, and I like to get at least the basic mineral package. Helps us kind of give an idea of what we need to be supplementing for minerals, or if there's any high minerals.
And so what are some of the extra ones? So if I was submitting a canola hay, what would your add-ons be?
We'd definitely be looking at, I think it's sulfur in, I don't remember if sulfur is in the base mineral package. Probably nitrates, just because I like to test everything for nitrates. Probably want to make sure you have fat in there or ether extract, just to be on the safe side.
And is NIR analysis okay, or should we be getting wet chemistry done?
It depends. Everything with nutrition is it depends. If you have something that is super commonly tested, like a corn silage, NIR is fine. Anything that's kind of weird and out there, like say a canola hay, I would say go with wet chemistry. NIR uses calculations based off of the average of other feeds of that type. So when you have something kind of strange, there's not a lot of data to fall off of. So I go wet chemistry usually just to be safe.
All right. Thank you for your questions. At this time, I would like to thank everyone for joining us for session 4 of our fall webinar series. And I would especially like to thank Dr. John Campbell and Adriane Good for their presentations today. Be sure to watch your email inbox for our bonus session on ergot and mycotoxins with Dr. Barry Blakely. And these recorded sessions will be available to all participants in the coming weeks. If you have any further questions regarding any topics covered today or other related questions and inquiries, please feel free to contact the nearest agricultural regional office or contact the Agriculture Knowledge Center at 1-866-457-2377. You may also visit our website at saskatchewan.ca/agriculture. Thank you again for joining us today and have an excellent afternoon.